Hi guys, this is Tiffany again. I told you I would come back on to let you know what was going on with Sam. I am actually sitting in my car, as you can see. Unfortunately, I cannot go live inside of the hospital. It's basically a dead zone as soon as you walk through the doors of the animal hospital. Cell service doesn't work, Wi-Fi doesn't work. So I could not go live while I was in there, but I wanted to update you guys on what exactly is happening. I brought her in and they rushed her back immediately and then brought me in a room, and the doctor came in and told me that yes, she's critical, and they needed to rush her in for an emergency blood transfusion. Her PVC was 8%. 8%. That is probably like one of the lowest that we've ever had on any dog. So they gave me the estimate with everything that needed to be done. Of course, you know, they had to pull blood, they had to cross match, they had to look for a donor dog, all of this stuff. Basically, the bill for 24 to 48 hours to stabilize her is the low end $3,065, the high end $3,600, which of course we had to put down 75% of that to get things started. So we just paid $2,700 here at the hospital to attempt to try and save little Sam's life. 8% her blood level is at. She's got almost no blood. So there's no guarantee that she is going to make it, but we are going to do everything possible to try and save her life, which means she has to have this transfusion, and she has to have it right now. They did allow me to go back and see her really quickly and give her a little kiss on the nose. And I told her that we all love her and that we are praying for her and that we were pulling for her and that she had to get better. And they had already started pulling the ticks off of her. They had already started the cross match. She already had the IV line in. So they were getting started right away for her. So I'm begging you guys to please donate. As I said, we already paid $2,700 just now. We had to do that to get things started, and we had to do it now. She could not wait. Honestly, in 4,000 dogs and all the blood transfusions that we've done for our dogs, I don't think we've ever had a dog at 8%. I knew she was in bad shape. I just didn't realize how bad. So please, guys, donate towards her care, and please pray that they're able to get her blood level up and stabilize her, and then we can see if it was just purely the neglect and the tick infestation that caused such a dramatic anemia in her, or if it's other things that are going on as well. I assumed that she was old. The doctor told me she did not think she was that old, which is even more heartbreaking, that this dog is in this condition and is not, you know, a 12 to 14-year-old senior. She said, no, she does not believe she's that old. Her teeth are in really good shape. So again, that makes it even more heartbreaking that this poor dog is in that condition. So, her kidneys, we don't know. They're running a full blood panel on her. But right now, the most critical thing is to get blood in her, or she's not going to survive. So that is their first and foremost concern, and that is what they are doing immediately, is pulling the blood from a donor dog, doing cross-matching, and getting blood in her immediately. It takes 4 hours for a transfusion. They have to do it slowly. They monitor her through the entire time. They constantly are checking her temperature and her vital signs to make sure that she can handle the transfusion. If for some reason she spikes a fever during it, they have to stop. We're praying to God that is not the case, because we want her to have this entire blood transfusion and get the blood that she so desperately needs. But it is a process, and to do it safely, it does take time. And like I said, it's costly. You know, she's got 3 nurses around her and her doctor. They're going to be basically on top of her during this 4-hour transfusion, monitoring her constantly, listening to her heart, listening to her lungs, checking her temperature. So it is not cheap to try and save her life. So I'm asking you all to please donate towards her care. I will update, oops, I did not mean to do that. I will update as I know more. I did take a little picture of her when I was in there with her, and I will post it on this post. But please donate for Sam. Please pray for Sam. And as soon as we have word how she's doing with the transfusion and after the transfusion, and we talk to the doctors, we will update more. This is Tiffany at Coral Springs Animal Hospital with Sam, who we just pulled from death row at Miami-Dade Animal Services. 100 plus abandoned dogs of Everglades, Florida.